This is Robert Kraft, and I'm your host on SNN Network. And joining me today is Matt Stang. He is the co-founder and CEO of Delic Corp. It's a publicly traded company. I got two symbols for you: DELC on the CSE and DELCF on the OTCQB. And Delic will be presenting at our upcoming in-person investor conference, the Planet MicroCap Showcase, happening May 3rd through the 5th, 2022 at Bally's Hotel and Casino in Las Vegas. To register and see his presentation live, go to planetmicrocapshowcase.com. And with that, Matt, thank you so much for joining me today. How are you doing?
I'm doing great. Thanks so much for having me.
It's great to have you on. So this is our first time doing an interview together discussing Delic. So can you start us off with a quick overview and history of the company?
Yeah, sure. So Delic was founded 4 years ago by myself and my wife as the world's first psychedelic wellness corporation. We're really focused on mainstreaming psychedelic wellness. We've gone on to become the largest chain of clinic operators in America. We have 13 clinics in 9 states. Right now we do ketamine infusions. Obviously, as other psychedelics become legal and FDA accredited, we will be doing those as well. We also have the largest psychedelic wellness event in America, Meet Delic. Happens in Las Vegas in November. We had 2,500 people last year. We have a lab, Delic Labs, in Canada that has licenses from Health Canada for psychedelics, cannabis, hemp, etc., doing outsourced research on novel compounds. And we have Reality Sandwich, a platform with a couple 100,000 people a month coming to find out news and information about psychedelic lifestyle. So, trying to be an ecosystem that really helps people discover the mainstream effects of psychedelic wellness.
I mean, okay, so you founded 4 years ago. So that was before this whole psychedelics boom that happened about 18 months ago. So what was the original, I guess, motivation for why you founded it? And then from there, what would you say makes Delic unique and different compared to some of your peers out there?
Sure. So, for us, it was really about the power of psychedelics to heal. My background, 20 years in the cannabis space, was an owner and operator of a company called High Times for many years. Sold it to a private equity group in 2017 and, helped them run it for a while. But this was kind of our next chapter. We really believed that psychedelics were incredibly powerful as a healing modality for folks. Very personal for myself and my wife. My wife has an anxiety disorder, and she found ketamine therapy, and it changed her life and allowed her to be much more open and much less, living in trauma, right? And I think when you find that for someone you love and it's so powerful, it really just changes how you act and makes you want to bring that to more people. And so that's really been the big focus. The other focus is that I've spent a lot of my life working on legalizing cannabis, and I think, not to say we got there, but we're pretty close to being there. And I think psychedelics are what's next, right? And they're so powerful and so scientifically backed and based. You look at the science, it's magnificent on how this helps with depression and helps with anxiety, it helps with all of these other mental health issues, PTSD, people who have been through war and combat, and just so many people it can help. And then just that, you look at the pandemic and the last 2 years of trauma and horrible isolation and suicidality going up 5 or 6 times where it was before. And, I think this is something whose time has come, and we believe incredibly strongly. And so that's why we created this. When you ask what differentiates us, we're the biggest in the country, right? We're the largest chain of clinics. We see 1,100 people a month. We've seen 75,000 patients, and really do it at high quality at scale. And I think the only way you're going to change things is scale. And so being the largest scaled clinic operator in the space gives us a huge advantage, and the ability to really help set the tone and work with large payer insurers and really build the framework for psychedelic wellness for the future. And so I really don't see any competitors We're very much in our own lane. We built our own platform and our own direct-to-consumer media ecosystem that allows us to bring patients directly without having to go through an intermediary step or work through a big platform. And we think that's a huge advantage.
Absolutely. So I wanted to kind of bridge the gap, right? Because I think everyone who is maybe getting introduced to understanding the psychedelics industry probably had some exposure or is aware of what was going on in the cannabis industry. And that industry has clearly matured much faster now than, me and you, we've gone back a few years now, right? Having been in our events before. But to give some context, I mean, is cannabis, when we're talking about patient care, I mean, is cannabis now viewed as kind of like the ibuprofen, so to speak, and then now and then you should think about psychedelics as that next step up for, let's say it's the same patient with anxiety or some form of mental health disorder. Is it like that, or I don't know? Give me a little bit of context.
Sure. Well, I mean, I think when I look at this, I think mental health treatment is broken in this country, and you have a couple of drugs that are thrown at just about everyone, whether it's a SSRI for depression or Xanax anti-anxiety for anxiety. And, they work for maybe 40-50% of people. They have terrible side effects. They leave you feeling like shit. People tell me they feel like walking zombies. The stories are just endless. And I think when you look at this, cannabis is an incredible plant medicine for folks who have anxiety and some amount of PTSD, but it's not a cure-all, and it doesn't actually have curative properties. What it does is help people maintain themselves and allow them to continue forward in their life. When you look at the science around psychedelics, there's curative properties. You look at the phase 3 clinical trials for MDMA and psilocybin, and they're showing 50, 60, 70% of people who are cured of their mental health disorder 1 year after their treatment. So there's huge numbers of people who are now better, which is something that none of these pharmaceuticals can claim. And I think that's just, it's a difference of magnitudes, orders of magnitude. And I think, the other big thing is cannabis was kept out of science, right? You had the way that you could access cannabis for scientific research was incredibly hard, very difficult. And the product was from the University of Mississippi, and I've seen it. I've been around someone who smoked it. It's literally disgusting. And it's like 4% THC, and it looks like just garbage. It's worse than the worst Mexi weed that you might see somewhere in the southwestern part of America. And so to get access, you have to spend 4 or 5 years applying, and you probably won't even get it. Now, when you look at the work that's been done with psychedelics, you can actually get psilocybin, you can actually get MDMA to do trial research. So there's now hundreds of pieces of properly done scientific research that show how incredibly powerful psychedelics are for mental health disorders. So, when I look at this, I say this is a whole order of magnitude beyond cannabis. Cannabis is an incredible recreational substance. It's safer than alcohol and cigarettes, and should be totally legal and available for folks who want to take the edge off and not have to drink a Chardonnay, right? I think that's a big part. And then, my mother passed from cancer, and she went through it 3 different times in her life. And cannabis was the only thing that let her eat when she had chemotherapy, and the only thing that let her sleep when she had chemo brain. And that was transformative. And once people see that, they can never deny someone the right to have medical marijuana when you look at it, right? And so that's
100%.
Where cannabis is so powerful is in the physicality of the endocannabinoid system and the ability to regulate it in a way that your body might not be properly regulating it, right? Now, when you look at psychedelics, what psychedelics can do is actually give people the ability to process trauma that is otherwise going to affect their ability to live a beneficial life. Which, I mean, everybody's got trauma. And after the last 2 years, everybody's got trauma, right? And I think there's just a huge demand for this, and we've seen it with our clinics and the amount of growth we've seen over the last year. It's just been staggering. And we think that continues forward as people even understand it's out there. And I think this is the biggest thing. People don't know that they have this available yet. I think there's, you know, maybe a couple percentage points of the population even know this exists right now. And that's the biggest inflection point, is as people realize, as the New York Times puts it on the cover, which happened 5 times in the last 6 months, as Time Magazine puts it on the cover, as the Wall Street Journal puts it on the cover, as CNN puts on a special, as Netflix puts on a special, all the big media companies are really jumping on it in the last year because it is transformative. Psychedelics can be transformative. Now, I think the other piece of this is that there's a lot of bullshit out there, and there's a lot of people who are doing psychedelic work, with air quotes, where they're just doing drugs, right? And that's totally, I'm not opposed to people enjoying themselves and having a recreational time. I just think what we're creating is a medical framework for people to deal with their mental health disorders. And most of these people are dead enders who have tried multiple things and never had any success and are just desperate for some way to be better. And not only them, but their families, their friends. I don't know if you've ever had anyone who is in a deep depression or heavily in anxiety. It's really difficult for the people around them, right? We had to start a program where we're actually counseling families on how to deal with their family members who are now out of that, because they're so used to dealing with it. It comes as almost a shock to see someone out of that depression and out of that anxiety, and now they're living a normal life. Well, how do you do that? How do you interact with that as a family member who spent the last 5, 10, 12 years dealing with someone in this space? And it's retraining the family as well as a big part of this.
Right. Yeah, no, I mean, look, it's my feeling is that psychedelics it's at that similar stage where cannabis was, where people were like, wait, I'm gonna trip out or something. Like, people are probably still associating psychedelics as we're going on a vision quest, versus some of the medical use cases, right? So, totally. But to close this out today, because look, I feel like we could talk forever about where everything is going, and we'll definitely probably have some more conversations down the road. But to close this out here today, from what you can tell us, what would you say are some of the company's value catalysts now for the rest of 2022?
Sure. Well, I think, being a real business is a big value catalyst. Having a real revenue. We ended last year with over $8 million run rate, and we expect that to keep growing. As we report the next couple of quarters, you'll see these things actually do real business. They make hundreds of thousands to $1 million per clinic, depending on how mature they are. And, we think there's just a huge demand for this that has not been satisfied at all, because people don't even know to ask for it, right? And I think that's a big part of our mission, is to let people know that this exists, that there is an option. So, when I look at what is a value catalyst, I think it's just building something that's really real, that helps people, that makes real revenue and real profit. And that's something that I think a lot of people looking at psychedelics have looked at a bunch of air, right? There's a bunch of, we're going to do this in 5 years, or we're going to do this in 7 years. Well, we're doing it today, and we're going to make real money helping people.
Very good. Well, Matt, with that, where can our audience go and find more information on Delic?
Sure. So deliccorp.com is the corporate website. It has all of the other sites linked to it. You can go to Ketamine Wellness Centers. That's our clinic business. You can go to deliclabs.com. That's our lab. Realitysandwich.com. That's our media platform. And you can go to meetdelic.com if you want to come and learn more in person in Vegas.
Very good. Well, Matt, thank you so much for joining me today. I really do appreciate it. Good luck. Stay safe. I'll see you soon.
Thank you so much.